what ADHD really is. Across the world, millions of children, teenagers, and adults live with experiences shaped by ADHD, a neurodevelopmental condition that affects focus, organisation, impulse control, and attention. Behind every diagnosis is a deeply human story. A young man remembers taking medication as a child. Everyone told him he would eventually grow out of ADHD, so he stopped taking his medication in college. Now, everyday life feels overwhelming again. A teenage girl sits frustrated at her desk. School subjects like maths feel boring, even though her teacher insists she's capable. To her, the challenges linked to ADHD make it feel impossible. Another student calls himself a failure because he constantly loses things, forgets homework, and struggles to keep up. He can't understand why tasks that seem simple for others feel so difficult for him, largely because of symptoms connected to ADHD. A young woman wonders why work seems effortless for everyone else. She hates feeling different, and the daily reality of managing ADHD makes her feel even more out of place. These voices reflect the inner world of many people living with this condition. Most children begin showing symptoms long before anyone realizes ADHD is involved. Teachers often notice difficulties when schoolwork requires planning, organization, or sustained focus. Some kids appear not to listen, even though they're trying. Others fall behind because they lose materials, forget assignments, or struggle to stay focused long enough to complete tasks. Parents sometimes worry their child has a hearing issue because instructions don't seem to register. In reality, the challenge often comes from attention patterns shaped by ADHD, not by hearing problems. Experts classify symptoms related to ADHD into 3 main presentations. 1. Inattentive type. People with this pattern may lose things constantly, forget homework or tasks, feel disorganized, struggle with details, drift off mentally, especially when uninterested. 2. Hyperactive/impulsive type. Individuals may have trouble sitting still, interrupt often, talk excessively, act without thinking, move or fidget at inappropriate times, struggle to wait their turn. 3. Combined type. Some people experience symptoms from both categories, creating a blended presentation. To meet diagnostic criteria, a person usually needs 6 or more symptoms from one group, or a mix totaling 6. Although the condition is most commonly identified in childhood, a large number of teenagers continue to experience symptoms, and many adults live with long-term effects connected to ADHD. Only a portion outgrow it entirely. Support and treatment options can significantly improve daily life for people dealing with ADHD. For younger children, behaviour therapy, with strong involvement from parents, often works best. Families learn strategies that create structure, routine, and consistency. Older children, teens, and adults often benefit most from medication, sometimes combined with therapy. Stimulant medications help sharpen focus and reduce distractibility, while non-stimulant options support those who do not respond well to stimulants. Therapy offers practical tools such as time management techniques, organisation systems, planning strategies, breaking tasks into manageable steps. These skills can transform school performance, job success, and home life. Life can feel more challenging for people navigating symptoms associated with ADHD, especially in school, work, and relationships. But with support, education, and effective treatment, countless individuals thrive. Many learn how to structure their environments, develop personal strengths, and understand how their brain works best. Creativity, passion, resilience, energy, and innovation often shine when ADHD is supported properly. This is a challenge, not a limitation. Millions succeed, not despite their diagnosis, but because they learn how to channel its strengths. A brain shaped by ADHD is not broken, it's simply wired differently. With the right tools, understanding, and support, that wiring can become a true source of strength. Like and subscribe for more neurodiverse content.